everything you've been told about swollen ankles after 60 is incomplete. Not entirely wrong, but missing the one piece that actually changes everything. Because here's the truth most people never hear. If your ankles keep swelling and your first instinct is to check your blood pressure, cut salt, or panic about heart failure, you might be looking in the wrong direction. And that mistake, it keeps millions of people stuck. So instead of doing what everyone else does, I want you to do something different right now. Look down at your legs, not casually really look, and ask yourself one simple, uncomfortable question. When was the last time your calves actually worked? Not walking from the couch to the kitchen, not shifting your feet while standing. I mean truly engaged, contracting, pumping, moving with purpose. Because hidden beneath your skin is a system almost nobody talks about. Yet it may be the real reason your ankles are swelling. And once you understand it, you'll never look at your body the same way again. Most people assume that swelling after a certain age is just part of getting older. Others go straight to fear, thinking it must be something serious, something dangerous, something tied to the heart. And that fear is understandable. But after nearly 15 years in emergency medicine and preventative care, I've seen something very different. I've watched hundreds of patients come in terrified, convinced their swollen feet meant heart failure, only to discover their heart was completely fine, perfectly stable, no emergency, no creases. So what was causing the swelling? Something quieter, something slower, something almost invisible. Their lymphatic system. Hi, I'm Dr. Lyenna. And over the years, I started noticing a pattern, one that completely changed how I understand aging and the body. We've been conditioned to believe that every symptom after 60 is a warning sign of something breaking down. But the body doesn't work that way. In fact, it's often doing exactly what it was designed to do, just without the support it needs anymore. And when it comes to swollen ankles, the real issue in many cases isn't failure, it's congestion. Here's what almost no one explains during a routine appointment. Your body doesn't just have one circulation system. You already know about the main one, your blood circulation. Your heart pumps blood through your arteries, delivering oxygen and nutrients. Then your veins carry it back. That system gets all the attention. But there's a second system running alongside it, just as important, but rarely discussed. A system responsible for fluid balance, waste removal, and immune function. That system is your lymphatic system. And when it slows down, the signs show up exactly where you're noticing them. Around your ankles. Let me give you a simple way to picture it. Imagine you're home. You have clean water flowing in through pipes. That's your blood circulation. But you also need a way to drain excess water, waste, and runoff. That's your drainage system. Now, imagine what would happen if your drainage system slowed down or stopped working properly. Even if clean water keeps flowing in, things start to back up. Overflow, pool, stagnate. That's exactly what happens inside your body when your lymphatic system isn't moving properly. And here's the part that changes everything. Your heart is a powerful pump. It beats around 100,000 times every single day, pushing blood through your body with force. But your lymphatic system, it has no pump at all. None. Zero. It relies entirely on something else, something most people unknowingly lose over time. Your lymphatic flow depends on three things. The contraction of your muscles, the way you breathe, especially deep, diaphragmatic breathing, tiny one-way valves inside your lymph vessels. When you're younger and active, this system works beautifully. You move more. You breathe deeper. Your muscles naturally help push fluid where it needs to go. But after 60, something starts to change. Gradually, quietly, almost unnoticed, muscle mass begins to decline. Movement becomes less frequent. Breathing becomes shallower. And the lymphatic vessels themselves, they start to lose strength. Not dramatically, not overnight, but enough that fluid that should be moving upward starts to slow down, then stall, then pool. And one day, you notice something different. Your socks leave deeper marks. Your shoes feel tighter. Your ankles look puffier, heavier, swollen. And your first thought is fear. What's wrong with my heart? But in a large number of cases, your heart isn't the problem. Your drainage system is. This condition has a name, lymphatic insufficiency. And research has shown that its likelihood increases significantly after the age of 65, even in people who've never had surgery, injury, or illness affecting the lymphatic system. The pattern is usually the same. Swelling appears in both legs. It starts at the ankles and slowly moves upward over time. But here's where things get really interesting. Because once you understand why this system slows down, you also begin to see how it can be restarted. Not with medication, not with extreme interventions, but with something far simpler, something your body already knows how to do, something you've been doing your entire life, just not in the way your body now needs. And it all comes down to 3 specific biological changes happening inside you right now. Changes that most people never even realize are happening. But once you see them, you can't unsee them. And more importantly, you can start to reverse them. What if the real problem isn't what you feel, but what your body has slowly stopped doing? Because right now, without pain, without warning, your internal drainage system could be weakening in ways you've never been told to look for. And the first place it starts is deep inside the very vessels meant to protect you. Let's begin with something most people have never even considered. Your lymphatic vessels are not just passive tubes. They are alive. They contract. They move. They actively push fluid through your body, just like tiny distributed pumps. But unlike your heart, which is strong and centralized, these vessels rely on their own structural strength to function. And that's exactly where the first problem begins. 1. The structural decline you can't see. As you age, the smooth muscle cells that surround your lymphatic vessels begin to weaken. Not suddenly, not dramatically, but steadily. And over time, that matters more than you think. Because these muscles are responsible for gently squeezing lymph fluid forward step by step, inch by inch, against gravity. When they lose tone, that forward movement slows, then becomes inefficient, then starts to fail. Research has shown that aging leads to reduced lymphatic vessel density realized, increased permeability, meaning they become leakier, decreased ability to clear fluid and waste. In simple terms, your drainage pipes are no longer as tight or as strong as they used to be. Think of it like an old garden hose. When it's new, water flows smoothly from one end to the other. But over time, it softens. It bulges in places. Tiny leaks form. And the pressure drops. The water still moves, but not efficiently. Not powerfully. Not enough. Inside your body, that leakiness means fluid doesn't stay contained where it should. It seeps into surrounding tissues. It lingers. And without enough force to move it along, it begins to collect, right where gravity pulls it most. Your lower legs, your ankles. But this is only the first layer of the problem. Because even if your vessels were perfect, they still need something else to keep fluid moving upward. Something far more powerful than most people realize. 2, the pump you've been underusing your entire life. Here's something that surprises almost everyone. Around 60% of your lymph nodes are located below your diaphragm. That dome-shaped muscle sitting just beneath your lungs. Now here's where it gets interesting. Every time you take a deep, slow breath into your belly, your diaphragm moves downward. And when it does, it creates a vacuum effect inside your chest. That vacuum literally pulls lymph fluid upward through your body. There's a major vessel called the thoracic duct. It handles roughly 75% of all lymphatic drainage in your entire system, and it responds directly to your breathing. Not your walking, not your posture, your breathing. In fact, clinical observations have shown something remarkable. When people walked, lymph flow increased slightly. But when they performed deep diaphragmatic breathing, flow increased dramatically, significantly more than walking alone. Let that sink in. Breathing properly can move your lymphatic fluid more effectively than exercise. But here's the problem. Most people over 60 don't breathe this way anymore. They breathe shallowly. Short, upper chest breaths, barely engaging the diaphragm at all. Without realizing it, they've essentially turned off one of the most powerful drainage mechanisms in their body. And when that happens, fluid that should be lifted upward stays down, settles, pools. So now you have 2 things happening at once. Weakened lymphatic vessels, a deactivated breathing pump, and together, they create the perfect environment for swelling. But we're still not at the most important piece, because even if your vessels are weaker and your breathing is shallow, there's one system that can still compensate powerfully. When it's active, 3. The second heart most people stop using. In Japanese medicine, there's a concept that has gained global recognition in vascular science. Your calf muscles are known as your second heart. And this isn't metaphor. It's biomechanics. Here's why. Your heart can easily push blood downward toward your feet. Gravity helps. But getting that fluid back up, that's the hard part. Every time your calf muscles contract, they compress the veins and lymphatic vessels in your legs. That compression physically pushes fluid upward, against gravity, back toward your core. It's a pump, a mechanical pump, and it works every time you move. But what happens if you stop using it? The answer is immediate. Within minutes of sitting or standing still, fluid begins to pool in your lower legs. Blood slows, lymph stagnates, pressure builds, and over time, your calf muscles themselves begin to shrink, weaken, lose efficiency. Studies have shown that individuals with chronic cardiovascular issues often have significantly smaller, weaker calf muscles because the connection is direct. When the calf pump weakens, circulation suffers. After 60, this becomes incredibly common. Less walking, more sitting, less muscle engagement. And gradually, your second heart starts to shut down. Now combine all 3 factors: weak lymphatic vessels, shallow breathing, inactive calf muscles. And what do you get? A system that can no longer move fluid efficiently. A system that allows buildup instead of flow. A system that creates swelling not because something is failing, but because something has stopped being used. And this is where everything begins to shift. Because once you understand that your body hasn't lost the system, it's just stopped activating it, you realize something powerful. This isn't permanent. It's not irreversibly. And it's not something you're stuck with, because the same mechanisms that slowed down can be reactivated quickly, naturally, without medication. And what researchers discovered next changes how we approach this entirely. Because in controlled studies, something incredibly simple, just a few minutes of specific movement and breathing, created measurable, immediate improvements in swelling. The kind of improvements you can actually feel, sometimes within minutes. And the method? It didn't come from a hospital, or a pharmaceutical company, or an expensive treatment plan. It came from a simple, structured routine practiced daily in Japan. A routine that takes less than 5 minutes, but directly targets all 3 of these failing systems at once. And once you see how it works, you'll understand why most people have been overlooking the simplest solution right in front of them. What if the solution isn't complicated, but simply ignored? Because after everything you've just learned, the weakening vessels, the shallow breathing, the inactive calf muscles, you might be expecting a complex fix, a long program, a strict routine, something difficult. But what researchers discovered is almost the opposite. The most effective intervention wasn't intense. It wasn't expensive. It wasn't even time-consuming. It was simple, consistent, and incredibly precise. And it started with a question. What happens when you reactivate all 3 lymphatic drivers at the same time? Not separately, not randomly, but deliberately. To answer that, researchers began studying older adults, many in their 60s and 70s, who were experiencing swelling, reduced mobility, and signs of lymphatic stagnation. They weren't athletes. They weren't following strict health programs. They were everyday people. And instead of giving them medication, they introduced something unexpected. A short, structured sequence of gentle, rhythmic movements combined with deep breathing. Inspired by traditional Japanese daily exercise routines, the results were impossible to ignore. Participants who followed this routine for just a few minutes a day showed improved fluid movement, reduced visible swelling, better physical function, higher energy levels, and perhaps most importantly, they actually stuck with it because it didn't feel overwhelming. But here's where it gets even more interesting. In separate clinical observations, researchers tested deep diaphragmatic breathing combined with simple limb movements. They measured limb volume before and after. What they found was immediate, not weeks later, not months later. Immediately after the session, there was a measurable reduction in swelling, and the effect didn't vanish instantly. It lasted. Let that sink in. Your body can begin correcting fluid imbalance in real time. if you activate the right systems. So now the question becomes, what exactly were they doing? What was the method? Because this is where everything shifts from understanding to action. The 5-minute morning lymphatic activation routine. This is not random movement. Each step targets a specific mechanism we talked about earlier. Each step has a purpose, and together they create a powerful, synchronized effect. Step 1, diaphragmatic activation, 2 minutes. This is where everything begins, because without activating your breathing pump, nothing else works as effectively. Sit or stand comfortably. Place one hand on your chest, the other on your belly. Now breathe in slowly through your nose for a count of 4. But here's the key. Let the air go deep into your abdomen. Your belly should rise. Your chest should stay mostly still. Hold that breath gently for 2 seconds. Then exhale slowly through your mouth for a count of 6. Controlled. Steady. Repeat this cycle 8 to 10 times. What you're doing here is more than just relaxing. You're creating a pressure shift inside your body. A vacuum effect. One that pulls lymph fluid upward from your lower body. For many people, this alone begins to create a noticeable difference. But we're just getting started. Step 2, calf pump activation 1 minute. Now we activate your second heart. Stand upright. Slowly rise onto your toes. Feel your calf muscles contract. Hold at the top for about 2 seconds. Then lower back down. Repeat this 15 to 20 times. Slowly. Deliberately. If balance is an issue, hold on to a chair or counter. That's completely fine. What matters is the contraction. Because every time your calves tighten, they squeeze the vessels in your legs and physically push fluid upward. This is the mechanical force your lymphatic system depends on. And for many people, it's been inactive for years. Step 3, rhythmic arm and torso movement, 1 minute. Now we open the major lymphatic junctions. Stand with your feet shoulder width apart. Let your arms swing gently forward and backward. Don't force it. Let it feel natural. Allow your torso to rotate slightly with the motion. After about 30 seconds, shift into side bends. Raise one arm overhead and lean gently to the opposite side. Alternate back and forth. This movement stimulates key lymph node clusters in your armpits, neck, abdomen. These are major drainage hubs. And when they're activated, flow improves across the entire system. Step 4, ankle activation, 1 minute. Now we target the area where swelling shows up first. Sit down. Extend one leg. Rotate your ankle slowly in large circles. 10 times clockwise. 10 times counterclockwise. Then flex your toes toward your shin and point them away. Repeat 10 times. Switch legs and repeat. This step activates the smallest pumps in your system, the micro movements that help move fluid out of the most congested areas. And just like that, you're done. 5 minutes, that's all it takes to activate your breathing pump, your muscle pump, your lymphatic pathways. But here's the part most people underestimate. It's not just about doing it once. It's about when you do it, because timing changes everything. When you wake up, your body has been horizontal for hours. Fluid is more evenly distributed, not yet pulled down by gravity. The moment you stand, everything begins to shift downward. So if you activate your system before that buildup happens, you're working with your body, not trying to fix it after the fact. And that single shift in timing, it can completely change the results you see. But movement is only part of the equation, because even if you activate your system perfectly, what you put into your body every day can either support that flow or quietly slow it back down again. And most people are unknowingly doing the second, because there are specific foods, specific compounds that directly strengthen or weaken your lymphatic system. And once you know what they are, you start to realize that your daily meals are either helping your body drain properly or contributing to the very swelling you're trying to eliminate. What if the reason your swelling keeps coming back isn't because the routine isn't working, but because something you eat every day is quietly slowing everything down again? Because here's the part most people miss. You can activate your lymphatic system perfectly in the morning. But if your internal environment doesn't support flow, that progress starts reversing within hours. Think of it this way. Your lymphatic system is like a river. Movement clears the path, but what you eat determines the quality of what's flowing through it. If that fluid becomes thick, inflamed, or overloaded with waste, It doesn't matter how strong your pumps are. Flow slows down. And here's the reality. After 60, your body becomes far more sensitive to what you consume. Not because it's weaker, but because it's less forgiving. So now the focus shifts from just movement to internal support, because when you combine the right foods with the routine you just learned, that's when real, lasting change begins. Let's break down the 7 most effective, evidence-supported foods that directly improve lymphatic function. Not trends, not guesses, but foods that work with your body's biology. 1. Dark leafy greens, your daily cleanser. Start with something simple. Spinach, kale, Swiss chard. These are rich in chlorophyll, a plant compound that supports the purification of lymph fluid. They also help maintain the integrity of your lymphatic vessel walls, which, as you now know, weaken over time. Aim for 1 to 2 cups daily. Lightly steamed, not overcooked, because too much heat destroys the very compounds your body needs. 2. Citrus fruits. Structural support from within. Oranges, grapefruit, lemons. These are loaded with vitamin C and bioflavonoids, and their role is critical because your lymphatic vessels depend on collagen for strength. As collagen declines with age, vessels become fragile and leaky. Vitamin C helps rebuild that structure. But here's the key most people overlook. Eat the whole fruit, not juice. The fiber slows absorption and supports your gut, which plays a larger role in fluid balance than most people realize. 3. Raw garlic, the circulation activator. This one surprises a lot of people. Garlic isn't just for flavor. It's a powerful anti-inflammatory and circulation booster, but only if you use it correctly. Crush it, then let it sit for about 10 minutes before eating. This activates a compound that supports vascular health and reduces inflammation. 2 critical factors for proper lymphatic flow. 4. Ginger, gentle but powerful movement support. Fresh ginger, grated into tea, or added to meals. Its active compounds help stimulate circulation and reduce tissue inflammation, which directly affects how easily fluid moves through your system. A simple ginger tea in the morning alongside your routine creates a powerful combined effect. 5. Walnuts. Flexibility for your vessels. A small handful a day. That's all you need. Walnuts are rich in omega-3 fatty acids. These help maintain the flexibility of your blood and lymphatic vessels. Because stiffness in those vessels, it restricts flow. But here's something important. Store them properly. Keep them in the refrigerator. Because when their oils go bad, they lose their benefits. 6. Berries. Protection at the cellular level. Blueberries, cranberries, blackberries. These contain compounds that protect your lymphatic system from oxidative stress, which quietly damages the cells lining your vessels over time. Cranberries, in particular, have a unique effect. They help break down accumulated waste in lymphatic fluid. Half a cup daily is enough. Fresh or frozen. Both work. 7. Turmeric, the inflammation controller. This is one of the most researched natural compounds in the world, but most people use it incorrectly. Turmeric needs 2 things to work: black pepper and fat. Without them, your body absorbs almost none of it. With them, absorption increases dramatically. And what it does is powerful. It reduces chronic, low-grade inflammation, the kind that slowly damages your lymphatic vessels over time. Now, here's what ties all of this together. It's not about perfection. It's about consistency. You don't need to eat everything perfectly every day. But when these foods become part of your routine, your body starts to shift. Fluid becomes lighter. Flow becomes easier. And the work you're doing with movement finally starts to hold. But even with the right routine and the right foods, there's something else that can completely undo your progress without you even realizing it. Small habits, daily patterns, things that seem harmless, but quietly make swelling worse. And I've seen these mistakes over and over again, even in people doing everything else right, because sometimes it's not what you're missing. It's what you're doing wrong without knowing it.